The use of vinegar as a medication on an ambulance? What? Let's talk about it. Hi, if we're just now meeting, I'm Stacy, I'm a paramedic, and it's Monday. And you know what that means? Medication Monday. We go over a different medication every single Monday, and today we'll be talking about acetic acid, aka vinegar. Acetic acid falls under the drug class of irrigating solutions. Now, why would we have this on the ambulance or out in the EMS field? For two conditions specifically. The first condition that we give it for is a condition called otitis externa, and that's just a fancy way of saying inflammation for the outer ear canal, specifically the tube that goes from the outer ear to the eardrum. A lot of times it'll get red and inflamed, and oftentimes they refer to it as swimmer's ear, just because swimmers are so much more prone to it because of the constant exposure to water. And the second indication for acetic acid, if you can't already tell by this picture, is pain control following a jellyfish sting. Now, I want to be very, very clear and specific on this one. This is usually for jellyfish stings outside of the U.S. coastal waters. It is not the recommended practice in the United States. There are different recommendations for that, but this is applicable to specific species of jellyfish. How does acetic acid work on otitis externa? Just to be clear, otitis externa doesn't necessarily mean there's an infection. It could indicate that, but it's the redness, the inflammation, the discomfort that the patient feels. The way that acetic acid works is it kind of slows down that multiplication of bacteria and fungi, just kind of putting a stop to the overall expansion of it. And it's thought to provide stabilization for the nematocyst discharge, specifically in the jellyfish that are found outside of the U.S. coastal waters. As always, before we get into it, follow your local protocol on dosages. But for the otitis externa indication, 4 to 6 drops in the affected ear is going to be the recommended dose. And for the jellyfish indication, you just want to irrigate and rinse that area really, really well. As for adverse reactions, your patient could experience burning or stinging of the skin. And as for drug interactions, you don't really have to worry about that for acetic acid. There's still quite a bit of conflicting information if vinegar should even routinely be used for jellyfish stings outside of the US, but inside of the US, if somebody gets stung by a jellyfish, most of the time it's treated with hot water and monitored for infection. I know all of my EMS peeps who watch this entire video are like, we don't carry acetic acid on the ambulance, but there are some areas that do carry acetic acid, and at the end of the day, it's being taught in the books now, so we have to talk about it.